Let's get to Eric Calciano, who you know has joined me here on the Dawn Show, lead benefits advisor with New City Insurance, and is really quite amazing when you think about somebody who can advocate and be an advocacy, be part of an advocacy group for employee benefits, for consulting and that sort of thing. Hey, Eric, good morning.
Hi, Dawn. How's it going today?
Good. So I know we'll talk. There was a CBS Market Watch story, and we'll talk about that in a moment. But if you will, did you hear what I was talking about beforehand, or I don't know if you were on hold, if Anthony had you on hold, or if you could hear what I was saying?
I did. I heard what you were talking about, and I agreed with everything that you were talking about there. And while you were discussing that, I was doing a quick look up on the change in United Health Group's stock prices in the last 10 years. Mm-hmm. And we're seeing about a 10x increase from about $53 to $538 for their stocks. And so you imagine everything that's going on with the benefits that they provide to their employees. They're providing the highest deductibles, highest out-of-pocket maximums in the plans that they provide to not just employers, but also on their Medicare, Medicaid, everything else. The worst coverage that they've ever provided, and yet they're taking the biggest profits that they've ever taken. It's
outrageous to me. It's infuriating. So what, as somebody, this is obviously your wheelhouse, Eric Calciano, what advice do you have for people as we try to navigate through, what's happening right now? And it just feels like these companies, I don't know, it feels like they have a free reign. I know I believe in capitalism and I believe in the free market, but wow, they're making a fortune. They're making a killing, literally. And I feel that it's on the backs of Americans, seniors, children.
Yeah, I don't think that we really have a free market in this scenario. There's so much barrier to entry for companies to come in. It's really like we have a small number of insurers that can fit into any market. And so as long as they're only competing with a few others, then there's not really true competition. And so that's part of the reason why I think we see the problem. I agree with you. I think if we had better competition, then we would be able to see prices come down. And for the individual who's getting these plans, it's the biggest thing that they can do is understand what their best options are in an imperfect system, because that's what we have right now is an imperfect system. So that's understanding when do I qualify for lower cost healthcare, like through Medicaid? When do I qualify for subsidized healthcare through Affordable Care Act coverage? When do I qualify for care like Medicare when you're getting to age 65 or older? Those are all components of understanding where can I get my best plan for my dollar. And then when enrolling in a plan, understanding what those plans offer, understanding also what they don't offer. And you were talking about going through an appeals process, and unfortunately that is a reality of what a lot of people have to do. But when they did a survey, there was a recent survey that showed that 60% of individuals did not realize that they could appeal a claim determination. So a denied claim, they didn't realize that they could go back to the insurance carrier and say that, no, I need you to take another look at this. So understanding that is often part of what individuals have to do, and be a self-advocate and have their doctor work with them to refile the claim, appeal the claim. And oftentimes when you go through that process, it will get approved, but it oftentimes requires that extra step.
Yeah, well, they've hit the mother load of a big mama bear. I'm like a dog on a bone. So I will not shake loose. I surely won't.
I love that. That's what they need. They need to get that tenacity in there.
Yeah, and so ultimately, and I saw Anthony Dorenzo, our executive producer, had given me, this CBS Money Watch and some of the things you've responded to, talking about for a lot of Americans unable to get the medical care that you need, despite even carrying health insurance. And there was this stat that 30% of working age adults in the United States with health coverage said the rising medical costs make it really hard to afford essentials, even like food or, I mean, everything's going up, especially utilities, car payments, loans, etc. What's your advice as far as people trying to navigate through the system?
Well, it's a lot of what I had mentioned in regards to being a self-advocate, making sure you're educated on what's available to you. But unfortunately, we are a part of what is offered to us. We only have the benefits that are available. And so a lot of that comes down to, for most people, about 55% of individuals are covered through their employer. We have then about 18% on Medicaid and another 18% on Medicare. So by far and away, the largest proportion of Americans are covered on employer health plans. And the employees themselves don't typically, unless they work in HR or they're the CFO or the CEO, they don't really get to decide how a plan is run. They just get offered the set of plans to their employers each year. And so a lot of the power is in the hands of the employers to manage plans better, to manage claims costs better, and really follow their fiduciary liability, their fiduciary responsibility, I should say, that they need to do what's best for their employees and the dependents and the families of those employees that are on that health plan. And so that's where a lot of the change, I believe, will happen, is employers taking control of their health plans and not accepting these inflated costs that they're receiving from their health insurer.
And so, in fact, I've seen where there have been stories that have been done and news reports where people have actually left one employer, actually shopped for an employer because they were shopping with, because maybe they have children or a spouse or themselves, they have health issues. And they were going by, as far as looking at the insurance plans that were being offered as one of the perks that they wanted to make sure they received, which brings me to what you do, which is essentially, under the umbrella of insurance thought leadership, that you're a partner at New City Insurance, and what you've specialized in building those custom health plans. How does somebody, do you work with employers, employees? How does that roll out?
Yeah, we work first with the employers, and then we help the employees when it comes to making their elections and what plans to enroll in. But it really starts, and the most important component of it is with the employers. And what we do with them with custom health plans is we're really targeting the largest cost driver on their health plan, which is claims. So 80% of every dollar that's spent on healthcare goes towards claims. And so what we're doing is looking at those claims that are most volatile, the ones that are most inflationary, and looking at how we can source those claims more effectively. So you were talking about, for example, sourcing prescription drugs and the really high costs of those drugs, and how if you just hop across the border to Canada, it's a fraction of the cost over there. Well, there are ways that you can source prescription drugs internationally from a Canadian pharmacy, and employers can take advantage of that and get the same drug, the same exact formula, the same exact the manufacturer of the drug. Just it was shipped from a Canadian pharmacy, and it drops the cost of the drug oftentimes by more than half. So taking advantage of those types of solutions can drastically reduce the costs, not only for those individuals that are on those drugs, but also for everybody else who's on the health plan. Because when you're with an employer pool, then everybody helps everybody else out, which is great. That's the point of insurance, is that we can all help each other. But let's also make sure that we're not dealing with unnecessary costs when we do it.
And what about people writing to their Congress member and looking at the laws that exist? Because ultimately, too, so when Congress, let's say they look at a big financial package, they delayed, in other words, having to deal with the full budget as they move forward. But sometimes written into these massive, spending bills, we have in there in the fine print, there are things like this as far as insurance, the insurance industry. And of course, this is a huge lobbyist group. So as far as that, do you ever advise people, in other words, talking to your Congress member, looking at legislation and whether it's friendly to consumers, that sort of thing?
That's one of the things that will be necessary for large scale change, is seeing it happen on a government level, because it really comes down to, this industry is heavily regulated. And if we're seeing price gouging and everything else that's going on, then it's going to be essentially the complaints of individuals that are going to make its way up. But that is a slower process. So will that happen this year or 5 years or 10 years from now? That's the unknown. And a lot of people have problems today. And so that's why my main focus is, how do we help businesses today do that? But certainly I say the more that individuals can advocate with their representatives, the more power to them. I think that's a great thing to do.
So what's the greatest area of growth that you're seeing? I mean, I'm thinking about, for example, with youth, especially post-pandemic, law enforcement, military, in so many different areas, we see this mental health crisis, especially for teenagers. Is that because in the past, a lot of those mental health type coverages were not happening, or they had huge copays? I'm just wondering, what are the greatest areas of growth as far as the insurance industry and what you're seeing?
There was certainly a huge spike in demand for mental health care. A lot of businesses were able to not only find good solutions during the pandemic with that, the ones that were conscientious of what was being offered to their employees and how to provide that at an efficient cost during the pandemic, during that spike of demand. So we saw, for example, employers would roll out, even mid-plan year, the ability to start doing telemental health visits when nobody was really wanted to go in person. There was too much fear of contracting COVID. So being able to provide access to that in a remote, safe environment, and at the same time, when done remotely, significantly reduce the cost, because they're a fraction of the cost of in-person visits, providing a solution that was cost effective and safe, and what was really preferred by many of the individuals. So we saw solutions like that. Recently, one of the big pieces that we're seeing happen in healthcare is the rise of weight loss drugs, obesity drugs, that are recently being approved by the FDA for that usage. So we've seen Ozempic and Wegovy are two prescriptions that were originally for diabetes treatment, that are now being used first as off-label for weight loss, and now actually FDA approved for weight loss. And not only weight loss, but there's also trials that are showing that it decreases heart attack and stroke. So the healthcare side effects that are associated with obesity. So these have some real potential to do a lot of good. They also cost about $10,000 to $15,000 per year for the individual. So it's a really high cost drug. And so health plans, employers, insurers are all basically deciding, can we afford to have this on our formulary? Because while it's very helpful for the individual, we're also concerned about bankrupting the plan, because sourcing these drugs can be so costly. Right. So that's a struggle. And are some plans covered and others are not? Is that it really becomes an issue of, do you take it on as a company for your health insurance, right? And then which one, because some people might want Ozempic. I guess some people want Wegovy. So they wouldn't pay $1,000 if their insurance company covered it. Right. If their insurance company covers it, they just pay a copay. But the issue is that more and more businesses are actually moving away from covering it right now because of the really high cost. So one of the biggest ones was the North Carolina State Plan, which has about 750,000 people on that plan. And their treasurer, who helps manage the plan, said, we have a fiduciary responsibility for our plan to not go bankrupt. And when we're seeing such a drastic increase in the number of these prescriptions, we are threatening to bankrupt our health plan if we go down this road. So they've stopped entirely offering it. So it's a really tough situation because it's beneficial for the individuals, and those individuals, many of them have indicated through surveys, I believe it was right about 40% of individuals that were obese indicated that they would be willing to switch jobs if they got those drugs covered. So there's a high demand for it. But at the same time, the businesses are saying, well, how can we pay for this? So.
Yeah, and I'd seen even this summer there were as many as 7 FDA approved drugs for weight management. So all these different kinds of drugs, including the ones you mentioned. Are there some that are considered better by the insurance industry as effective, and yet not the more than $1,000 a month?
As far as what I've seen, it's really these newest ones that are being presented as the drugs that are having the greatest effect with the lowest side effects. Yeah. We can go actually back about a decade or so when Medicare used to provide weight loss drugs, and then it was determined that these weight loss drugs were causing so many side effects that the actual problems associated with the drug were higher than the benefits. And now that was that long ago that Medicare said, we will no longer cover any weight loss drugs. So that's actually written into Medicare, is that they will not cover any weight loss drugs at all. Now, if we see something change, if we see that at the end of the day that Ozempic or Wegovy have no side effects, and really we're just seeing these positive effects of reduced weight, reduced heart attack, reduced stroke risk, then we might see that change. But the history of weight loss drugs is actually a pretty shaky one, because we've seen it go the wrong way before. Yeah,
this is true. What's your advice, to somebody out there who, whether they're in the marketplace, the ACA marketplace, or whether they're looking at Medicare, Medicaid, or within a private insurance company with a work plan, what's the first thing you tell people, Eric?
If they're trying to figure out which coverage is going to be best for them, my advice is to work with an expert. Find somebody who's good at what they do and speak with them. If you aren't a car mechanic, you wouldn't work on your car yourself typically, right? Or at least you'd at least speak with an expert about something if there was a problem that you couldn't solve. It's the same thing. Healthcare is extremely complex. As we're discussing right now, there's all of these unique specific components of any given plan. You experience the trouble with the prescriptions with United Healthcare. You may not have experienced that same trouble with Aetna potentially, but not because Aetna is any better, but just because they have unique differences between them. And it's the insights from somebody who does this as their career that can help that. The key there is you just want to find somebody who you feel that has your best interest in mind and isn't just looking for a commission. So somebody who really takes the time to say, what are you looking for in your plan, and how can we accomplish that?
Well, Eric, I really appreciate you. I hope you have a wonderful Thanksgiving week. As we're ending on talking about diet plans and all the weight loss drugs. It's probably, it's a challenging week for all of us, right? To be healthy, play that flag football before or after the Thanksgiving meal. But Eric Calciano, thank you so much. I really appreciate you. Until next time.
Thank you, Don. I appreciate you having me as well. Have a happy Thanksgiving.
Thank you, Eric. And if you want to read more about Eric Calciano, he's the lead benefits advisor of New City Insurance. And really, there are rave reviews about Eric, for example, on LinkedIn, as he's somebody who is a lead benefits manager. And so can, take people through all of that, and gives a lot of talks to groups, and really acts as, in many ways, an advocate.